Hi, I'm Dr. Eric Mazer. Today's Ask the Doctor question is, how do you determine if a patient with cancer of the pancreas is a candidate for surgery? Well, we have an oncologic surgeon on the set, Dr. Ram Seshadri. I'm not going to get your first name right. I'm sorry, Dr. Ram Seshadri.
Yeah, I go by Ram anyway. So,
but how do you determine? Obviously, this is the kind of big surgery you do. How do you determine whether somebody's eligible for surgery or not?
So there are certain key factors that go into play when you determine whether a patient is a surgical candidate or not. First is their overall well-being. Like, are they physically fit? Age is no longer a criteria. You can have a perfectly fit 95-year-old young lady that would be perfectly fine to undergo this procedure, whereas you may have a 40-year-old male who has several medical comorbidities that could preclude them from becoming a surgical candidate. So I think that part of it is the initial screening. Subsequently, with respect to the tumor itself, location is key, because of the way the pancreas, sits in the body. So one of my mentors who trained me always used to say is God purposely put the pancreas all the way in the back so that no one would mess with it. But
and
here we are.
About 15 seconds left. So
okay. Respect to blood vessels. So if the tumor is wrapped around a blood vessel, it technically becomes harder to resect those. But if it is just touching them, and we know this both from the endoscopy that they do the ultrasound with, as well as cross-sectional imaging.
So it's really how much they're involving surrounding tissues and how literally, if you can take it out without hurting irreversibly
yes,
the patient.
Blood vessels are key.
Thank you so much. I think a lot of people don't realize that. Unfortunately, we have run out of time. I want to thank our guest, Dr. Ramanathan Seshadri, for joining us on Health Talk today. And thank you for watching. Remember to share your questions and comments by emailing us at healthtalk@nuvancehealth.org. Stay well, don't drink, don't smoke. See your primary care doctor. Bye-bye.